Have you ever looked in the mirror and noticed that your teeth seem to be getting longer? Or maybe you've felt a sudden, sharp sensitivity to hot or cold that you never had before. These are not just signs of aging. They are the first subtle warning signs of a condition that affects millions, yet is often misunderstood and ignored until it's too late. Gum recession. Your dentist might tell you it's common, but they often don't have the time to explain the deep, underlying causes, the full spectrum of what to expect, and the unspoken truths about treatment. They might not tell you how a simple, common habit could be actively destroying your gums every single day. Today, we are pulling back the curtain. This is not a lecture. This is the honest, unfiltered guide to understanding and addressing gum recession that you need. We will cover everything from how to spot the earliest signs to the hidden causes beyond just brushing and the truth about what professional treatments really entail. The information in this video is designed to empower you to stop the damage, protect your smile, and make the best possible decision for your long-term health. The warning signs, how to self-diagnose. The first step to taking control is becoming a detective in your own mouth. Gum recession can be insidious, starting slowly and progressing over years. Here are the specific signs you need to look for, from the earliest clues to the more advanced warnings. The most obvious sign, as we mentioned, is the appearance of longer teeth. But let's be more specific. Look closely at the line where your tooth meets your gum. Do you see a yellowish border appearing at the base of the tooth? That yellowish material is the tooth's root surface, called dentin. It has a different color and texture than the white enamel of the crown, and it should be covered by your gums. Seeing this border is a definitive sign that the gum has pulled back, exposing the root. The second, and often first noticed symptom is increased sensitivity. The root of your tooth is not covered by protective enamel. It's covered by a softer layer called cementum, and it's porous, with thousands of tiny tubules that lead directly to the nerve of the tooth. When the gum recedes and exposes this surface, it's like leaving a nerve ending exposed to the elements. This is why you might suddenly feel a sharp, shooting pain when you consume hot coffee, cold ice cream, or even breathe in cold air. It's not a sign of a weak tooth. It's a sign of an exposed root. The third sign is something you can feel. Run your tongue along the base of your teeth, right at the gum line. Do you feel a little step or a notch? This is often a sign of what's called abfraction, which can be caused by grinding, but it's also where the gum has receded from the tooth. You might also notice a change in the color of your gums. Healthy gums are typically a light pink color and are firm to the touch. Inflamed, receding gums can often look red, swollen, and puffy, and may bleed when you brush. In the more advanced stages, as you lose both gum and the underlying bone that supports the tooth, you may begin to feel that the tooth is becoming loose. This is a critical warning sign that the structural integrity of the tooth is compromised, and you are at a high risk of tooth loss. Understanding the stages of recession. Gum recession is not an all-or-nothing condition. Dentists classify it in stages, and understanding where you are on this spectrum is key to understanding your treatment options. Stage 1 is mild recession. This is typically defined as a recession of up to 3 millimeters. At this stage, you might notice some sensitivity and the slight appearance of a yellow root surface, but it's often not very noticeable aesthetically. For many people, if the recession is stable and not causing major sensitivity or decay, the treatment is often non-surgical. It's about identifying and eliminating the cause, which we'll get to in a moment, and improving your oral hygiene to prevent it from getting worse. Stage 2 is moderate recession. This is defined as a recession of 3 to 5 millimeters. At this stage, the aesthetic concerns become more apparent. The long tooth look is more noticeable, and the dark spaces, or black triangles, between the teeth can become larger. Sensitivity is usually more pronounced, and the exposed root surface is at a much higher risk for cavities, as it's much softer than enamel. At this stage, non-surgical management is often not enough to solve the problem, and your dentist will likely start discussing surgical options to restore the lost gum tissue. Stage 3 is severe recession. This is any recession that is more than 5 millimeters. At this stage, the structural integrity of the tooth is in serious jeopardy. You have lost a significant amount of both gum tissue and the underlying bone. The tooth may be noticeably loose, sensitivity can be extreme, and the aesthetic impact is significant. At this point, surgical intervention is almost always necessary, not just for cosmetic reasons, but to save the tooth from being lost entirely. The root causes dentists often overlook. So, why does this happen? Most dentists will tell you the number one cause is brushing too hard. And while that is a major factor, it's far from the whole story. Let's uncover the hidden causes. The first, as mentioned, is aggressive brushing. Using a toothbrush with hard or even medium bristles and scrubbing your teeth with a back-and-forth sawing motion is like taking sandpaper to your delicate gum tissue. Over years, this literally wears the gum away. The second cause, which is often linked, is plaque and tartar buildup. If you are not brushing effectively, a sticky film of bacteria called plaque builds up at the gum line. Over time, this hardens into tartar, or calculus. This tartar irritates the gums, causing inflammation, gingivitis, which, if left untreated, can destroy the underlying bone and cause the gums to recede. But here is a cause that is often overlooked: bruxism, or the chronic grinding and clenching of your teeth, especially at night. When you clench or grind, you are putting immense, unnatural forces on your teeth. This can cause the tooth to flex at the gum line, creating microscopic cracks and putting stress on the surrounding bone and gum tissue. This chronic stress can lead to inflammation and cause the gum to pull away from the tooth. If you wake up with a sore jaw, headaches, or if your partner tells you that you grind your teeth at night, this could be the hidden driver of your gum recession. Finally, genetics and tooth position play a role. Some people are simply born with thinner, more fragile gum tissue, making them more susceptible to recession. And if a tooth is positioned slightly out of the normal arch, the gum and bone over the root of that tooth can be paper thin, making it much more likely to recede under even normal forces. Understanding your specific cause is the absolute key to effective treatment. The truth about treatment, what to expect. Let's demystify the treatment process. This is where many people have the most fear, but understanding it is empowering. First, let's be clear. Gum tissue does not grow back on its own. There are no magical mouthwashes, oils, or home remedies that will make your gums regrow. Once the tissue is gone, it is gone forever without professional intervention. The internet is full of scams promoting such remedies. They are all ineffective. The first step in any professional treatment is to address the cause. This means a thorough professional cleaning to remove all tartar, and most importantly, a detailed lesson from your hygienist on proper brushing technique. This is non-negotiable. There is no point in fixing the recession if you are just going to cause it again. For moderate to severe cases, the solution is surgical. This is called gingivoplasty or a gum graft. While it sounds scary, it is a very common and highly successful procedure. The most common technique is a connective tissue graft. Here's how it works. The periodontist, gum specialist, will take a small, thin piece of tissue from the roof of your mouth, from an area that is not visible. They will then create a small pouch under the receding gum and gently suture this piece of donor tissue into place, covering the exposed root. Over the next few weeks, this new tissue will integrate with the existing gum, creating a thicker, stronger, and more stable gum line. Now, the truth about recovery. The donor site on the roof of your mouth is the area that is most uncomfortable, often described as feeling like a pizza burn. However, it typically heals very quickly, often within a week or two. The grafted site itself usually has minimal pain. The result is a dramatic improvement in both the health and the appearance of your gums, and a significant reduction in sensitivity. It is a highly effective procedure that can save teeth and restore your smile. Prevention and long-term care. Your action plan. Knowledge is only power when it's put into action. Here is your simple, actionable plan to prevent gum recession or stop it from getting worse, starting today. First, an audit of your tools. Throw away your hard and medium bristle toothbrushes immediately. You should only ever use a brush labeled soft or extra soft. Consider investing in a high-quality electric toothbrush with a pressure sensor. These are fantastic because they do the work for you and will warn you if you are pressing too hard. Second, master the technique. The correct way to brush is not a back-and-forth scrub. The most recommended technique is the modified Bass technique. You place the brush at a 45-degree angle to the gum line and use very gentle, short, circular or vibrating motions to clean the plaque from right under the gum line. Then you sweep the brush down or up and away from the gums. Ask your dental hygienist to demonstrate this for you at your next visit. It is the most important skill you can learn for your oral health. Third, get evaluated for grinding. If you suspect you grind your teeth at night, talk to your dentist about a custom-made night guard. This simple appliance won't stop you from grinding, but it will protect your teeth and gums from the destructive forces, which can be a game changer for preventing further recession. Fourth, support your gums from the inside out. Your gums are made of connective tissue, which is primarily collagen. To build and maintain healthy collagen, your body needs adequate vitamin C. Ensure your diet is rich in vitamin C from sources like bell peppers, broccoli, and kiwi. While diet is key, some research suggests that supplements like coenzyme Q10 can also support gum health. Gum recession can be an alarming diagnosis, but it is not a helpless one. By understanding the true causes, recognizing the early signs, and knowing the effective modern treatments available, you are no longer a passive patient. You are an informed partner in your own healthcare. You have the knowledge to change your habits, to seek the right professional help, and to protect your teeth for a lifetime. Thank you for trusting me with your time today. If this in-depth guide has given you the clarity and confidence you were looking for, please hit that like button and subscribe for more honest health insights. And now, I want to hear from you. What is the biggest question or concern you still have about gum recession? Ask it in the comments below, and let's continue the conversation.